Ladies, are you struggling with urinary leakage when you're running, jumping, laughing, coughing, or something like that? And maybe you've been told that this is normal by your doctor, your friends, your family members, but you're just wondering if this is something you're gonna have to live with for the rest of your life, or if there's something that you can actually do to help fix this problem, then today's video is for you. Hi there, I'm Dr. Amy with Physical Therapy for Everybody, and we have been seeing so many women in the clinic recently who are struggling with urinary incontinence. If you're tired of having to wear a pad every time you go out of the house or trying to figure out where the nearest bathroom is all the time, then you're going to learn a lot from today's video. The first thing we're going to talk about is the different types of urinary incontinence that there are. Because there are different types, and how you treat them is a little bit different as well, because it indicates different problems. We're also going to discuss when you should get help and who you would want to see for that problem. So, you ready to dive in? Here we go. First up, we're going to talk about stress incontinence. So stress incontinence is when you are losing urine when you're coughing, laughing, sneezing, or jumping, or anything that causes stress throughout the abdominal cavity. So the abdominal cavity is defined as the diaphragm on the top, that's your big breathing muscle, and you've got your pelvic floor on the bottom that forms the bottom of kind of that abdominal can, we call it. And what happens is that you get too much pressure in this area, and finally the pelvic floor is just like, hey, I just can't hold all of that pressure in, and a little bit of urine will leak out when you're in a stressful situation. So think about like when you're coughing, right, that increases your abdominal pressure. It's going to cause a little bit of leakage to come out. Same thing when you're jumping on a trampoline, and the stress of the jumping will cause potentially a little bit of leakage to come out. Now, I have heard of so many women who just assume that this is normal after childbirth. I am here to tell you that it is normal in the fact that so many people suffer from it. However, it is not something that has to be so. Just because many women have accepted this as their normal doesn't mean that you have to. There's actually some really easy techniques to help work on stress incontinence. This is one of the easier forms to work on because we can work on the pelvic floor, we can work on the diaphragm, we can get more abdominal control, more back control, and really get control of that whole container so that this doesn't bother you while you're doing the activities you like doing, or the activities that you just feel like you need to be doing because it's good for you, like running. Now the next type of incontinence we're going to talk about is urge incontinence. So this is when you have that really sudden urge to go to the bathroom, and a lot of times people can't make it there. They feel this intense need, but by the time they get to the bathroom, they find that they've already had an issue with incontinence. Now this is a little bit different because there can be some different things that are going on. You may have heard of someone who had this problem who had a UTI, and that is not uncommon at all, actually. So you may want to start with seeing a medical doctor if you feel like there's some burning that's going on with this, because chances are you may be suffering with the UTI, especially if it just came on like really suddenly. But if you don't have pain or burning when you're urinating, then chances are it's not a UTI. So then most likely it's either a diaphragm issue where your diaphragm is too tight, pelvic floor issue, usually where your pelvic floor is too tight. Many people think that it's because their pelvic floor is loose and it's not strong enough. I'll tell you that in my experience, most of the time, the issue is that the pelvic floor is too tight. And then you're asking it to hold on to a really, really full bladder, and it taps out. It just can't do it anymore. So a lot of times that pelvic floor just gets overwhelmed, basically, would be what happens. The other thing that can be happening, though, is that your bladder could be sitting in a strange position. Now this can be caused by a variety of issues. It could be due to constipation, it could be due to ligament laxity or fascial laxity in your abdominal cavity, and then you need someone who can help you get that bladder sitting back in the correct position. They may need to release some scar tissue, work through the mesentery. So for this, you're looking for a visceral manual therapist. So you're looking for someone who can work on your guts, quite frankly, because you need to get that bladder in the correct position. Ideally, if you're suffering with urge incontinence, you would want to see a pelvic floor specialist who has some training in visceral manipulation as well, because the two really go hand in hand, and it's all part of that abdominal can that we talked about earlier. Another type of incontinence is overflow incontinence. So this is for people who their bladder gets really full and it just starts to overflow because they're not able to make it to the bathroom on a frequently enough basis, and everything just kind of fills up. Also, people will suffer with overflow incontinence if they're not able to fully empty their bladder when they're going to the bathroom. So if this is you, you may feel like you've gone to the bathroom and you stand up and a little bit more comes out, or you pull up your underwear and your pants and there's a little bit on there, but you feel like you're just not able to get all of that out. This is probably a sign that your pelvic floor is really, really tight. This can also be a diaphragm issue. This can also be a bladder positioning issue, but most often it's because that pelvic floor is really tight and it's hard for you to get it all out. Now, a really simple trick to see if this is your pelvic floor is when you're sitting, try leaning to one side and see if you can get that little bit extra out. If you can, it's probably changing the dynamics of your pelvic floor, which is allowing that to come out, which is causing you to be able to fully empty your bladder, which is great. I mean, that's a great Band-Aid technique, and we are all about using Band-Aids for short periods of time because you've got to do what you've got to do, but it's not a good long-term technique. You really want to deal with that pelvic floor before it starts becoming another issue. Now, some people may say, I'm raising my hand to all of those because I feel like I have all of those problems. Then you probably have a mixed or combination incontinence issue. The most common combination we see is stress and urge. So that's when you have the difficulty with the running, jumping, laughing, coughing, but then you also have difficulty being able to make it to the bathroom in time before some of it leaks out. Those are most commonly seen together. So usually this indicates that there is indeed a problem with the pelvic floor, often the diaphragm too, because they work in conjunction together, as well as the bladder may be malpositioned. You may also notice that you have some difficulty with constipation. And when your internal organs get bigger because they're fuller, it can put more pressure on the bladder and cause a lot of problems. So you really want to find a specialist who's able to deal with all of these issues. Someone who can deal not only with your pelvic floor, but with your breathing diaphragm, that big muscle that's supposed to help you be able to take those deep breaths, as well as work with the viscera and make sure that they're moving correctly and not getting adhered down, as well as making sure we're talking about some tools to deal with the constipation. Now, to deal with the constipation, you may have a bigger issue that's outside of the scope of physical therapy practice. But if you're working with a professional who knows what's within their scope of practice and what's outside, it can be really, really helpful because they'll also have resources to be able to refer you to a provider who's going to be able to help you with that. I hope you found today's video helpful. If you did, definitely click that subscribe button. And if you're looking for more information, watch that video over there. Have a great day, everyone. Bye-bye.